Can you believe that I've known people on CPAP who have been doing it wrong for years because they don't understand the concept of mouth leaking? Imagine making the same mistake every night, and instead of doing something to help someone sleep, it was hurting them. Hi, I'm Dr. Alex Hakim, a board-certified physician in sleep medicine for Sleep.LA. A common CPAP complaint I get is, my machine wakes me up, it gets noisy or too noisy for my spouse, I feel gushing air, the pressure is too strong, and in the morning I have dry mouth even with humidification. These are all red flags for mouth leaking while using the device. The machine tries to build up pressure, and an explosive mouth leak renders the device ineffective and noisy as it works harder to overcome the leak. In the right hands, the ResMed AirSense 10 or AirSense 11 that we use should be so quiet that your sleep partner barely knows that it's on. Even at the start of the evening, when it seems the seal is good, you could be having mask leaks as the muscles of the jaw relax during sleep and the jaw drops down, opening the mouth. This is especially true with a nose-only mask, but can even happen with masks that cover both the nose and the mouth if the jaw drops too much. I'm going to discuss products that I purchased with my own money, and the opinions expressed have been developed through trial and error on myself and through collaborating with my patients, and is not a formal endorsement. You'll find product links in the description. There are 4 main ways to keep air from escaping from your mouth while using CPAP. 1. Using a full face mask that involves the mouth, which we already said could still leak. 2. Mouth taping. 3. Chin straps, and 4. Soft cervical collars. In the category of mouth tape, I like something called Cover Roll Stretch Tape. It forms a surprisingly good seal, yet is easy to remove without pain or irritation. They have different widths, but I suggest at least the 2-inch version depending on your face size. HypaFix tape is another popular choice with practically the same qualities, but I notice a mild odor that could be a little bothersome. 3M Micropore tape is another very skin-friendly tape that is more gentle and a little more challenging to peel and tear due to its thinness. What I really like this tape for is to reinforce masks, especially like the ResMed P10 and N30 that shift on the face. I like to put a small piece on each cheek to hold the front of the frame more securely. That seems to work great for those of you who toss and turn a lot. If a strong attachment to the skin is absolutely necessary, or reinforcing the plastic attachments of the CPAP is desired, my preferred tape is silk tape, as it's both strong and can peel off without much injury. For the face, however, it's probably too strong and leaves too much residue. As with all tapes, and especially this one, the area around the eyes must be carefully avoided, as it has the thinnest skin and is the most susceptible to injury during removal. Finally, there are more costly brand name tapes like Hostage tape, Mute Mouth tape, Hush strips, etc. I haven't needed to try them out given the current options. However, please leave your thoughts in the comment section so that we can learn from our experiences. Chin straps are a great option because when used without tape, a person can still talk, or if the person has unpredictable issues with the nose in terms of breathing, they can still sneak some mouth breaths using it. My recommended choice of chin strap is really based on jaw size. With people with strong jaws that are difficult to contain, the Philips Respironics Premium Chin Strap is great. The material is thick and sturdy, providing a solid wrapping experience, and has a back strap to keep the whole thing from sliding off the head. It also allows the ears to be free and uncovered, which is an underrated feature. Something like the Bistra Super Deluxe White Chin Strap may be just as strong, but covers the ears, which can then rub against them during the night, causing irritation. Ears also normally radiate heat to cool the head, and that becomes difficult when the ears are covered. The ResMed chin strap is thinner, but also made of a strong premium material, making it my chin strap of choice for smaller faces or people who need a little bit of jaw stability when using a larger mask that covers the nose and mouth. There are masks that look like this, or the Respironics one, but the materials chosen are important. If it's too stretchy, it won't be able to do its job. Amazon has a whole slew of real stretchy spandex or netting-like chin straps that are extremely breathable, cheap, and sell well, but struggle to stay firm. Another issue with a bunch of these straps are that they push the lower jaw backwards and not just straight up, which can actually make sleep apnea worse. I'm giving a special mention to the Knightsbridge premium brand of chin straps that have been recommended to me by several people, and I would encourage you to check them out. So far, I haven't needed to use them given the quality alternatives I have found at a lower price point. The final category to prevent mouth leaking is soft cervical collars, and it tends to be something easy to apply at night, allows the face to be freer and less irritated, and can really fix the jaw in place. However, unless someone can comfortably sleep with that degree of neck restriction, it can be challenging to adjust to. For those of you who are more on your back, who don't toss and turn, this might be a good choice for you, especially if the collar is soft and comfortable. I hear good things about the Caldera Relief Collar, but we'd like to hear from you in the comments section about your experiences and suggestions, as collars aren't something we use too often. If you have problems using CPAP or want to find out if leaking is an issue, consider having an investigation by me, Dr. Alex Hakim at sleepdocla.com.